With respect to self-treatment, I try and teach every patient engagement, stretching, useful activities that feel really relevant and connected to their symptoms. So if Melissa was coming to see me with some sort of a dysfunction, a problem, whether it's voice or globus or swallowing, something in this left upper to middle aspect of her neck, first of all, I never teach self-treatment without actually allowing her to feel what treatment feels like firsthand. So she has something to frame it with, okay? And we're using the dice sometimes for the sake of the camera and the demonstration. It gets in the way and blocks what you're trying to see, but the DICEM itself is a really useful tool for the patients to have, and every one of my patients goes home with a pair of DICEM so they can do some of this work on their own. So Melissa, what I'm going to ask you to do is you're going to do a hand up and under and then the other hand's going to come down in through an area like that. Now just like I did, I'm going to ask you not to just do one static stretch, but you're going to allow your hand or hands to sink in a little bit, and you're going to look around a little bit. You're going to look to see if you can replicate some of those feelings inside of you that we worked on when I had you on the table. And when you find it, you should be at a low level of pressure so it doesn't feel like you're going to hurt yourself. But it should be enough of an engagement, enough of a tension or stretch where it feels useful. Okay? So if that was it, then you could hold it. Now try letting go, if you will, and let's bring a hand up like this, okay? And maybe you want to lightly take hold and drag downward. Yeah, try not to let the DICEM slide. You're gripping your neck with just enough tension or pressure to keep the DICEM from sliding. And maybe that downward pressure feels useful. Maybe scooping up and under, like this. Under through here, right? And maybe you could add a second hand down into that area. We bring it down. Let your head and neck go up if you want. Don't do anything that feels like it's going to flare you up or feels too irritating in any way. Your hands are soft. They're seeking out that tightness within your neck area.